Today, our guest is Dr. Mridul Sahani, former President, Curriculum Committee, Central Council of Homeopathy, India, then Chairman and Convener of different organizations under Government of India, winner of various national and international awards, presentation at national and international forums with 45 years experience. The topic is diabetes, the imbalance of sweetness in life, approach in homeopathy. An important topic, a lot of persons are suffering from diabetes mellitus, and the medical world is struggling to give a solution to this problem, this vexing problem. It affects almost all sectors or stratas of this population, including the children. So on behalf of IFPH, welcome Dr. Mridul Sahani.
Oh, good evening, friends. So I am glad to be here again. We all talk about the diabetes, and we say that it is something happening with the sugar. But what I feel about the diabetes, I am going to share with you all. So diabetes, the imbalance, I say the imbalance, not the balance, not in proper, not in equilibrium. So of the sweetness in the life. It is, mind this word, sweetness is very important for the life. If you have the sweetness, you have the life. So this word is very important. And sweetness of life lies in the usefulness like honey deep into the heart of the clove bloom. Friends, sweets and salt. Celebrations begins with some sweets. There is a beautiful slogan, कुछ मीठा हो जाए, कुछ मीठा हो जाए. And after having salty food in meal, we seek some sweets. This is very, with this message, I am going to talk about the diabetes today. Now, there are the two opposite ends, sweet and the salt, and balance in life is needed to be maintained between the happiness and the sadness. Sometimes we are very happy, we are not sad. Sometimes we are very sad, but we are not happy. So there, and with this, there is an imbalance created. So now let us see. What is the diabetes? Diabetes, I say, it is a thief. It is the robber of sweetness in the life. And diabetes has been acclaimed as a metabolic disorder in which person cannot metabolize sugar in the blood. As the level of blood sugar known as glucose rises, especially over a prolonged period of years, the sugar becomes toxic to a number of systems in the body, including the cardiovascular system. And diabetes is also, I feel that it is fear of fully participating in the life. You are not enjoying the life. You are not having the proper understanding about the life. And there is great need for control and to know things. Deep need for attention and approval is important. And constant craving for love with a belief that you are unworthy or undeserving. Deep-seated guilt, belief you have to struggle to survive, can often lose yourself in relationship. Constant need for sweetness to mask the feeling of weakness, limitations, and belief that there is not enough. So this is very important. How much you are enjoying the life, how much the completeness of the life is there, how much you are fully participating mentally, physically, and spiritually with the life. This is the aspect that needs to be understood when we think about especially about the diabetes. The cell of our body needs glucose to produce energy, and brain's only food is the glucose. And glucose needs to be at certain level for the brain to function normally. After we reach sugar level, normally rises in the blood, triggering to release of a hormone called insulin from cell in the pancreas called beta cell. Insulin knows how to open the door of all our cells in the body, allowing glucose to enter them. As glucose enters the cell, sugar level drops off until we eat again. When we eat, the pancreas automatically produces the right amount of insulin to move glucose from blood into the cell. And in people with the diabetes, this insulin, there is a little or no insulin produced in it, or the cell do not respond properly to the insulin that is produced. So there are the various reasons. There are the insulin but level is low and there are no insulin. Or if the insulin is there, then it is not being properly responded by the cell. And glucose build up the blood, overflows into the urine and passes out of the body in the urine. Thus, the body loses its main source of fuel, even though the blood containing large amount of the glucose. Friends, we have understood about that there are two types of the diabetes. Diabetes, one is regarded as the autoimmune disease, and most common diabetes, which is becoming one of the 95 to 90% of the people with the diabetes are suffering from this type 2. And this is basically because of the old age, obesity, family history, previous history, just so many constraints that you are getting to manage with the managing the balance, that creates the type 2. And when this type 2 becomes overactivated, it acquires the position of the type 1 diabetes, that is autoimmune disorders. Now, predisposing factors for the type 1 diabetes are the genetic factors. A strong coordination in the monogenetic twins suggests a major role for genetic factors. The major histocompatibility complex antigen are thought to be important. Most type 1 patients shows either DR3 or DR4, while the DR2 is thought to be protective against the diabetes. And so it is auto antibody bodies in the type 1 diabetes. So isolate is not presented. And then for the factor 2, type 2 diabetes, there is a prevalence that is your lifestyle. I say basically it is the lifestyle that is important. With the latent autoimmune disease in the adult is thought to compose about 5% of all patients of that. So this is monogenic diabetes. Monogenic diabetes is the term used for a collection of conditions that cause diabetes, now shown as a result from single gene defects. So basically, it is related to our lifestyle disorders. Now, it is now becoming more convinced that there is an intimate and dynamic relationship between what is going on with our feeling and thought and what happens in the body. Mind affects our organ related to the diabetic changes in the body. And in the homeopathic approach of the treatment, patient has to be treated, not his partner. We are not going to treat the pancreas. We are not going to treat the system or the tissue. We are going to treat with the patient. And when we think about the patient himself, it is not the beta B cells that we have to overlook. We have to go through the life of the patient. So when the regular proper diet control, and even if there may be, you can have a daily routine, but if the happiness is not there, this is not going to create a balance. And the Hippocrates has rightly said, if someone wishes for good health, one must first ask himself if he is ready to do away with the reasons for all his illness. Only then it is possible to help him. So treating a diabetic patient is important, that we must understand that we have to convince the patient, we have to make them apply that you have to change your lifestyle. You have to change the way you have which is causing the problems to you. According to Dr. Henneman, there cannot be, strictly speaking, the local disease of the dynamic changes is never confined to a specific part of the organ, or central to understanding and managing the diabetes. The role of emotional etiology of diabetes has been source of debate. However, personality traits of the patient and configuration. Now, the personality character in diabetes is linked with the symbolic language of pancreas. The pancreas is linked to the solar plexus that deals with the emotions, wishes, and intellectual property. Diabetics are found to be more emotional and harbor many wishes for them and others. They tend to reproach themselves with discontentment or others. They spend much energy fulfilling the inner needs of their emotions, and there is associated inner sadness from unrequired love. Pancreas represents the sweetness of the life. There is another type of the diabetes which begins from the beginning, from the childhood, and this is known as the juvenile diabetes. The probable mental cause for the diabetes are longing for what we might have been, so great desire, the deep sorrow, no sweet. Then your mental attitude, refusing to give, withdrawing, withholding self from others, fear of never being able to have enough, thinking self does not have enough to give, therefore being stinging without one to give. Desire to give and holding back on this, fear of losing from giving attitude of self-righteousness, which is selfishness, conditionally giving and receiving jealousy. Constitutional antibiotic treatment, anti-miasmatic treatment, along with the due stress on preventive measures, plays a significant role in the radical cure of patients suffering from diabetes and also preventing long-term complications. There may be the three, we can group the diabetes under the three para, the SORA, psychosis, and the syphilis. This is the primary causes, and this is the dominating factor behind the disease. Then psychosis is type 2, the insulin resistance, and then so psychotic mass should be present, and syphilitic in the pathogenesis, it goes to the DM1, that means diabetes type of the 1. Samuel Hahnemann stated in his chronic disease that diabetes is a zoic manifestation. As per the above knowledge of different pathogenesis, we can consider this statement as prime true on the basic field of SORA. Other psychosis and syphilis can be built up on their own manifestation accordingly. And according to many stalwarts, diabetes belongs to a mixed miasmatic states of SORA and syphilis. There are 7 factors and homeopathic remedies. Genetic defects of beta cells, DNA are the methods, carcinosin, medorinum, tuberculinum, syphilinum. Diabetic mellitus resulting from disease of exocrine, pancreas, arsenical, baryta, mute, calcarea, ars, carb, and so many medicines are there. And diabetic resulting from endocrinopathy, baryta, carb, carcinosin, pituitary, posterior, ACTH, cortisonum, and several other medicines are there. And drug chemical induced diabetes are also there. So we have the long list of the medicines: agaricus, agnes, cast, arsenical, bryonia, camphor, etc. Then infections, carcinosin, medorinum, all the nosodes are there. Then there are gestational diabetes. It includes lactium acidium, helonius, sulfur, and immune mediated diabetes, DNA, nosodes, other nosodes are also there. Now, evolving the therapeutic index of the remedy, reportage the symptoms related to diabetes, clinical rubrics of diabetes, common symptoms, universal complication of the diabetes, the role of the love in diabetes. A study of the reportization filter, focusing on polycrest remedies, and evaluating the main remedy data, remedica and clinical experience, and developing the therapeutic index in order of their importance in the clinical practice and not necessarily on quantity of marks, the filter being used as an extra point more. In the synthesis repertory editions, you will find there are 92 medicines listed under the diabetes and 195 medicines under the diabetes mellitus. And under the other rubrics they are related to it, the sugar, urine chapter, 149 medicines are listed. And there are some therapeutic in the cordanium, when diabetic mellitus start after some nervous exhaustion, and diabetic like gunpowder, staphylococcus, and molecule altrifolia are extremely useful for diabetic carbuncle and gangrene. Then like urea pura, ampulosis, quinquefolia are extremely useful in the diabetic neuropathy. Now, diabetic neuropathy is a common complication of the diabetic, and it appears in the first manifestation of the disease. It is likely to occur in even the mildest case of the diabetes. And antisyphilitic remedies are very important here. Then diabetic neuropathy is an important case of the end-stage renal failure. In one case, Tupram Arsadnikam responded quickly. He was restored to consciousness, started passing urine, and at least for a few months, dialysis was not needed. Then another important complication is about the diabetic retinopathy. So retinal changes, microvascular retinal changes, hyperglycemia is produced. And the important medicines are carbon, naphthalene are often indicated. Now I will share one of the cases here to let you know how I progressed. There was a lady, 61-year female. She presented with the weakness in general, muscular pain all over the body, tearing pain in the legs, numbness and tingling in the legs while walking and sitting, coldness of extremities, frequent urine and vision blurred. Then associated complaints were pain in the joints, especially knee, sleeplessness after breakfast, desire to remain in bed all the time, and frequent vomiting with indigestions. Then the past history for her cyst in the knee was operated in 1997. Polypus was there in the uterus. Father died from and was depression. Mother was diabetic. She is one brother and two sisters. Married at the age of 24. Husband is a government officer. Now he is retired and he is diabetic. And he has one son and two daughters. She is a retired teacher. Liked working to remain busy, loves, discontented with life situation, easily affected by contradictions, gardening, always hurried, fond of eating, desire fits, aversion for the meat, and fasting aggravate, and flatulence of the eating. I reportized this case with the following rubrics: diabetes mellitus, neurological complaints accompanied, then mind occupations ameliorate, mind censorious, element from contradictions, discontent, diabetes mellitus, then extremities, numbness of the sitting eye. Helonius was the only medicines that covered all the 8 symptoms. You will see that Helonius, this is the Metamedica of Helonius, sadness aggravate on seeing other happiness. So it is a jealousy type of the things are there. And with this, we transmitted this Helonius in 0/1 potency, and on the 13th of the March and 25th of the March, the numbness was much better, and reported on 23rd April that insulin intake was reduced to 10 units only, feeling energetic and numbness tingling is no more, and treatment is continued. So some are the useful way tips for preventing the diabetes are: reduce sedentary lifestyle, care of gums, especially controlled diabetes, lack of or too much sleep raises diabetes, breastfeeding reduces mother's diabetic risk, The mother's stress triggers the diabetes in kids. Reduced waistline lowers the diabetes and heart risk. A spinal cord shrinks in diabetic neuropathy. Hepatitis C linked to type 2 diabetes, and psychotherapy helps control diabetes. Like laughter cuts the blood sugar. The treatment of diabetes mellitus in homeopathy is extremely effective, but people do not come to us in earlier stage, and hence once the pathology is advanced, we cannot cure but only palliate the conditions. So it is the sweetness to let the mind unbend on occasion. So with this, I will only have a message for you to be positive, to be happy, and so that to be helped with the so freedom is a state of the mind, and with this, if you have the freedom of the mind, you will not be suffering from the diabetes. So thank you so much. It is difficult for me to prescribe the medicines on the symptoms that you have spoke, because we are not getting the complete constitutional factor. We have to go to the complete history of the patient, and then only we can make some suggestions. And we must have an interaction, because I have to see the mind, I have seen the physical state and the life situations. This is very important for any of the case to come. There is the therapeutic approach are very misnomer for the diabetes therapy. It is only the diabetic. It is only the constitutional way that will help you to arrive at the and help the patient with the right medicines. Thyroidinum, if you think specifically, then I will say no, because I don't go like that. I go to the life history complete, and then any medicine. Thyroidinum can be covered under the totality, and that we have to follow the art of repertorization, where you can include. People say that with the repertorizations you only get the some of the common medicines, but I don't believe this, because even might have seen in the case that I got the Helonius. Helonius is not thought of in the diabetes case, but I did it, and I got the medicines only through the constitutional understanding. So this is very important. Thyroidinum may be indicated. There are the importance, because thyroidinum has got the great role on the maintaining the hormone of the body. This is important, but it is important, first important, how much it is affecting the patient, the constitution, how much the entire constitution is affected is very much important.
Usually, I am using the constitutional medicine for diabetes is at lower potency. And that also I am getting, if it is acid force, if it is lycopodium, if it is phosphorus, I am using, these are all lower potencies. Which for potency selection, what is your opinion for constitutional medicine?
When you look at the diabetes concept that I have given to you today, that imbalance of the sweetness in the mind. Basically, diabetes is maintained in the body in our life only because of our mental attitude. So if you are able to understand the mental attitude properly about the patients, his discontentment, his contradictions, his irritability, everything, then you can start with the higher potency. You can go up, because when the mind is very important, so it becomes more sensitive, because the law of the potency prescribing is higher the sensitivity, higher the potency. Higher the sensitivity, higher the potency, and lower the sensitivity, like the pathology. If you are thinking is based on the pathological aspect of the diabetes, then you can go think about the lower potency. But we have to think about the higher aspect of the diabetes, because diabetes is not that pathological reports are based on the something which is on the ground level. But where is the ruler? Which one is the guiding factor for that? That has, if you consider that, with there you will require the higher potency.
Higher potency means which potency you mean?
Usually, I am prescribing the LM potency. So higher potency, I go beyond 0/7 to 0/10.
Okay, thank you, sir. Thank you, sir.
Please, can you share your experiences in treating juvenile diabetes?
Yeah. There are few cases that came to me, and I was wondering that whether this child is suffering from the diabetes, but the sugar level was very high, and it was only about 18 years age boy was there. And with this way, I considered he was very much, his desire was very, what you can say, capriciousness. This was very important for his life because he always wants this, that, this, that. So he was very much demanding. It may be the life situations he might have developed. And taking these rubrics, capriciousness and other conditions, I got a very good result in the juvenile diabetes.
For juvenile diabetes, take the case of mother very correctly.
That
Then
is also
find
true,
out,
sir.
find
That
out
is
the
also true, sir.
is
Yeah,
it correct?
that is also true, sir.
Okay,
You
that
are-
is
you are very much correct. When a child comes or any, even if the adult, I go to the parents. I ask them, I talk, because it is not only the child, we also are affected by the child, because our father and mother, they have made our mind, they have made our life. So
Okay.
they are the architect. So until you see how they have been made, you can understand the person in a full way.
Effects of gestational diabetes can affect the baby, and can we correct it, sir?
Definitely, madam.
Effect
Definitely.
of gestational diabetes.
Yeah. Gestational, you have to go to the pregnancy history.
Okay.
And even before the pregnancy, this is very important in the gestational diabetes, because pregnancy history, most of the pregnant lady, they have the long, very bad history during the pregnancy. This can give you a very better rubrics for the treating the gestational diabetes. I'm very much convinced nowadays that diabetes is not related to the food habits. Yes, food habits have some contribution, but what you are eating, according to your choice, if your desire is fulfilled, then it is not going to cause you. So even with the patient who have a strong craving for the sweets, I allow them to take the sweets. I allow them to take the sweets. I allow them whatever they like, what is the strongest craving for them, because this will help them to maintain their emotions, control, satisfy their contentment will be there. So this contentment will act as a remedial measure for the patients. So don't feel that this thing is going to affect the diabetes, this thing is going to affect the diabetes. No, if you will think like that, then everything has got the positive, will become the positive factor for the diabetes, and everything will become the neutral factors for the diabetes.
Can you please give the explanation for why all ideal rubrics are categorized as severity, like conscientious, fastidious, religious, honest, etc., artistic, passionate?
This is different topic. Categorizations of the rubrics, it depends on the individual of the patient. Where to apply, which rubric is dominating in that patient, which rubric is dominating in that patient. This is it is not that we are using the fastidious, we are using the, because fastidious. Now, what you think about the fastidious? Fastidious about what? Now we can't say it is only about the dressing and the placing of the thing, the stiffness of the mind. Fastidious, not to be convinced that he's fastidious about the for the eating, he's fastidious about the time, he's fastidious, and on that categorization, now the new rubrics are also coming up. So the big rubrics, they are the large rubrics. Fastidious has become a very large rubric. Conscientious about trifle has become a large rubric. But among that, you have to come to the sub rubrics. Sub-rubrics are more important than the large rubrics. And if you are able to find sub-rubrics in the patient, you are getting a better, you are nearing to the more minimum of the patients.
I have also seen the patients who are taking the vegetables only. They come to the sugar is coming down as normal. But when they change their life habits, it will again go up. That means it is not a curing phase, but only for the time being that the sugar will come down. When they changes their food habits, it will go up.